Suprabhat to all of you. Ladies and gentlemen, we extend a very, very warm welcome to the 6th Global Cancer Summit 2024. The conference is being jointly organized by Biogenesis Health Cluster and Global Cancer Foundation with the theme, Living with Cancer in the 21st Century, United we stand to fight against cancer. The 6th Global Cancer Summit 2024 is the central congress where cancer researchers from all over, in different stages of their careers, have come together to discuss latest developments in the field of cancer research.
Today is a very eventful day for cancer. We have trying our best to give the proper recommendations to the Government of India. For the last 14 years, we are working with Planning Commission closely. And this time, I invited many friends. They all were supposed to come to this conference because of the Parliament. Session is in progress. They are not made up. Make it. And I think this is the winter. I don't know because we are just trying to. We pulled around 250 people, clinicians, scientists, research scholars, and students.
Malignancy, they are so much worried. I can show my record. 11:45, his father-in-law called me from Chennai. He said, what is happening? Whether he's going to remarry again, whether my grandsons will be on the stage. This is the situation. Of course, here what happens is we hardly find time to speak to any patients. For the oncologists here, I branched out to palliative medicine, which is most important in a country like India, where 80% of the patients still comes in advanced stage of cancer, in a developing country like India. All of them, they need good palliative care. But unfortunately, in a country like India, we speak least importance. And the previous speakers, Dr. Nitin and our Dr. Ravindran with 13 degrees. I was wondering where you had the time to get so many degrees. I'm happy that this kind of scientific activities should keep happening to update, and especially the research activities. And you are only telling that from Government of India.
More technology come into the practice, many people get involved into the field, in the industry, especially from the industrialist point of view. Then the government has to intervene and then regulate it and make it affordable. That's the challenge we are facing everywhere, not just in our country, everywhere. I have worked in various countries, to begin with Manipal, 10 years. Then I went to US, I was in Singapore, then I'm in Kuala Lumpur for the past 25 years. Challenges are similar, only the magnitude may differ, okay? So challenge is there, we are overcoming. I have seen a lot of changes happening here. So because last time we used to have only histopathology to diagnose cancer. First thing is cancer or no cancer? Okay, cancer, what type? Then you do the stage and you have a set of formulas available to you. Chemotherapy, radiotherapy, surgery. That's all, nothing more. At the most, little bit of hormone therapy and immunomodulators. Very primitive armamentarium in our treatment basket. Today, it is different. Those formulas don't apply today anymore. We are doing more molecular imagings, molecular pathologies, and then early detections in the patients who have already been treated for the recurrences. Okay, like the examples are like many of my predecessor speakers have spoken about a lot of innovations which they have done, like mutations and oncoproteins. Detection of all these things will help us in deciding what is the best treatment for each particular type of cancer, not just the type of cancer for a particular individual, not all.
And we have chosen a breast cancer because March 2024 WHO says 6,70,000 people dies only on breast cancer. So I am sharing my work, what I am doing in my laboratory with my postgraduate students in India and abroad. So WHO shows that 6,70,000 women dies March 2024 till that. So what was the cause of it? We failed to early detect the tumor, or our drugs are not so sensitive. First, our conservative approach, the patients come to the OPD or come in contact with the clinicians when the first or second stage is over. So you have to decide yourself what are the risk factors. No doubt.
Up to 10 micromolar we have taken, and 5C and 5H shows the best potency with the GBM6 cell lines by taking 10 micromolar dose and up to the 72 hours. So here, the anti-proliferative and anti-invasive effect of the 5C and 5H best potent with the earlier 3 cell lines that we further did the experiment with the help of collaborators, and you will find that the standards, that is the DMSO, these are the 2 effective compounds. So you can understand the invasive property. With the DMSO, the cancer cell is sprayed. And on the other hand, the 5H is also sprayed. But 5C compound is an invasive property that we identified, that is controlled with the cell. It is protected. So not only that, the several things we carried out, GBM6 2-hour treatment, we have 1C compound that can be treated up to 1 to 10 micromolar. And here also we carried out this experiment. And finally I'm talking about, so there is nothing but the DMSO treated cell lines. Here you can see that how the 5C, when we have to eat something, this is dirty. So we have to remove this. You will see this. With the 5C compound, 3 micromolar activity we catch and everything is clean. You will see here as compared to existing drug molecule which is available, temozolomide, with the 15 days.
I think I need to be a little fast. There are plasma membrane, cytoskeleton, nucleus. Again, why am I talking about it? Because many of them, the radiation doesn't really work, and even when it works, addition of hypothermia can enhance, augment the effects of radiation. The cancer stem cells are very potent, and they are the reason. They are the reason for failure following radiotherapy, and besides the other factors, the resistant stem cells can be really nasty and really lead to the failure because the disease comes back or disease fails to respond. Disease in this case is cancer. And it appears that these cancer stem cells are slightly more sensitive to heat. And there was a very good work wherein hypothermia, along with metformin. Metformin is a very common drug used in diabetes. When you combine that in the laboratory, it really enhanced the cell killing of the stem cells.
We conducted 7 clinical studies in our earlier model, and we got very good, very promising sensitivity and specificity results. Preliminary performance evaluation of clinical studies focused on these 4 points. The 4 different biomarkers in panel are prevalent in 90% of breast cancer, and if you go for a single biomarker, it goes to 70%. Performance is independent of ethnicity. We worked with multiple types of population, and greater than 85% of the sensitivity and specificity could be achieved in this clinical. Of course, we have to go for multicentric trial, we have to go for larger trials. We are on the road towards it. It will take some time. This is how the predictive analytics work. It showcases results in this pattern, and the results goes on cloud, and it can be accessed from anywhere.
PRP activity allows the cancer cells to repair their damaged DNA very efficiently, enabling them to continue dividing in spite of the application of conventional DNA damaging chemotherapeutic or radiotherapeutic treatments. Thus, we have made it as an Oncocure 10, this molecule. PRP1 is to be used to support the benefits of the application of conventional treatments, including radiation or chemotherapy also. So PRP to be administered to all the breast cancer patients with BRCA1 and 2 mutations and other cancers when being treated with chemotherapy or radiation therapy. Because as he is an allopathic scientist, he has shown this, but we can go standalone also, other molecules. So with this background, we have a molecules, but we want to take it in a scientific way, though everybody knows that highly diluted homeopathic medicines, if I say that, I have told only 6C. When you say it,
that you have to treat with steroids and the bladder problem. These are the worst. Other things aren't that bad. Skin irritation, dryness, vaginal pain, hair loss, feeling tired, that they will tolerate. And obviously they will have early menopause. We do explain this very well to our women that there will be premenopause due to this, and you will have so and so symptoms. So the long-term side effects, these depend on the dose and radiation, and obviously we know lymphedema can weaken their bones, causing fracture of the hip or pelvic bones, and bowel or bladder problems are, we know that. So then comes the chemotherapy in endometrial cancer. Its treatment that usually is given after operation. It is often administered in cycles with periods of treatment. The medicine we can use, or medicine which we are using nowadays, is carboplatin, paclitaxel, doxocis, platin. Although, so the
Dr. KB, Vice Chancellor, Sri Siddhartha Academy of Higher Education, Dr. V.P. Rao, Dr. Venkatakrishna, Dr. Chandrasekhar Hospate to do the honors. Congratulations. Congratulations to Dr. Ajit Kumar Saxena, who has been awarded the Edward Kennedy Memorial Award. Thank you. Dr. Hitendra. And I request all the dignitaries to do the honors. I request our Vice Chancellor. I request Dr. Lingegowda, Honorable Vice Chancellor of Sri Siddhartha Academy of Higher Education, Dr. Venkatakrishna, Dr. Chandrasekhar Hospate, and Dr. V.P. Rao to do the honors.
Recite the poetry stanza by stanza, and I will discuss each and every stanza. The first stanza goes like this. Now we find many persons are suffering from cancer. Globally, millions are dying due to cancer. They may be our relatives, friends, near and dear. Here it can be mentioned that 1 out of 5 persons will suffer from cancer in their lifetime. Now the second stanza, let me recite this stanza also. We have to fight boldly against cancer. Newer treatments are creating hope to the patients with cancer. We must endeavor with hope to find a world free of cancer. Hope may help to deal with cancer. Here, it can be mentioned that newer treatments like precision medicine or personalized medicine are creating hope to the patients with cancer.
Opportunities of AI, non-advanced development, innovative, fast, delayed release, target, very, very important target release, very difficult for target release drug. Okay, the pharmaceutical problem, the target release very, very difficult task. So colon release drugs. The colon, how much time take? Very less time. Throat infection, you take any cough syrup, take how much time? Within fraction of 5 to 10 minutes, the drug content will be go to the intestine. So this kind of things you smartly use. How much? What are the drug candidate you add? Either N-terminal amino acid, or C-terminal amino acid. Both are real. The product will be formed. It's like that you receptor analysis, receptor mapping. This kind of things AI will be used. Okay.
Series of inflammatory processes that starts up and a series of inflammatory reactions which finally lead in the form of cancer. That can be increased production of cytokines, that can be increased production of these antimicrobial peptides, or in patients of cervical cancer, that can lead to an increased pH which can ultimately lead to the reduction of the lactobacilli. It is said that chronic inflammation, majority of the inflammatory diseases start in the gut, and that can be a very simple term for those inflammatory reactions is actually a leaky gut when that mucosal barrier gets disturbed. Patient can even complain if it starts from a simple complaints like diarrhea or bloating. It can be diarrhea, it can be bloating, it can be intestinal bowel syndrome, it can be small intestinal diseases, it can be celiac. Even patients who are suffering from anxiety disorders, mood disorders, gluten enteropathy, autoimmune disorders.
Our lab motto is early detection, early detection, early detection. Because India, we know that it's a hub for medical tourism, especially Chennai. We get a lot of international patients coming from Africa, coming from UAE, coming from even Canada, coming from US, Australia, because it's a cost effective. As you can see, early stage, 100%, the cost is roughly rupees 5,000. As you can see, compared to the United States, you see early stage itself, you have to spend a lot of money and it doubles. But where you can go, the more stage increase, you have to spend a lot of money. And most of the our patients in our hospital, they come stage 3 and stage 4, and then they die. And then finally they say this hospital is not good, the doctor is not good. So basically it's up to patient side. And if patient turn to the early stage, the cancer can be curable 100%. And this is our motto for the prostate cancer treatment.
Bone cancer. So most probably this bone cancer is also coming up very rapidly nowadays, even for the youngsters. They are able to get, to begin with, it is like a symptoms of a bone pain and something like difficult in walking. And finally, most of them are being diagnosed at the stage of 2. And hence we wanted to go for it, and we wanted to check how this bone cancer is going to have an effect. And based on the Siddha medicines, we thought, why not we go for a prescription once we go for the research, how it works. So based on that, we were able to go for not using it directly, but we are going to go for this potentization. Hope many of you will be knowing about it, but potentization is nothing but we are going to reduce the quantity of the drug, whatever it has been suggested. So we are going to mix 1 in 99 parts, and the energy which flows to the drug, whatever, with the help of the mother lactose or with the help of the mother tincture, based on the drug, whether it is going to be a solid or liquid, we are going to mix it and we are going to potentize it into 1x to 10x. This is what we were planning for the screening level.
To give this combination, the formula which I had showed to you, with temozolomide for the better results. Now, it will inhibit the growth as well as it will also suppress the pathway like this, that RB and MGMT, that is methylation part. We need to stop it. Followed by when to give this drug or when to give this combination and when not to give. So there are certain contraindications. So number 1 for the cardiac problem, patient with CHF, because in this I have used imatinib and it is highly contraindicated for the cardiac patients. Even after the treated chemically the imatinib with it, but the toxicity part is still there for the cardiac patient who are having congestive heart failure, who have given a history of previous attack, maybe with a successful PTCA or any other else, but there will be an effect to there. As well as in a case of where pregnancy embryo-fetal toxicity, followed by the risk growth of stunting in the children and adolescent. Why? Because if a pregnant female come with this disease and if we apply
control study which aims to explore the prognostic significance of walks and runx to biomarker in osteosarcoma and with their clinical association with the clinical characteristics. Study. I followed the study methods from the patient recruitment from the OPD from the orthopedic surgery, King George Medical University with age-matched healthy controls. Tissue collection from the osteosarcoma patients, and for the which this is a case control study, and for the control patients I've taken the normal control samples, control patient samples from the traumatic injuries patients, and I've done the molecular analysis, real-time PCR and immunohistochemistry at the level of mRNA, and of course the immunohistochemistry is the protein level. So to diagnose, to
Despite all this, I still remember my mother, Kalyani Acharya, who was always by bedside, prayed for me, but left me, blessing me a long life. And of course, I am always grateful to Dr. Trilochan Mahapatra, Dr. Krishna Kumar, who is also from Bangalore. They were in constant touch with me despite my superannuation. They were taking updates from my family members. And I should bow down to Bharat Ratna Professor M.S. Swaminathan. I am fortunate to have his blessings. He invited me and boosted me and strengthened me. You must win over cancer and you must proceed with science. And same with our previous director, Dr. N.M. Nair, who is no more, but I always feel they should have been till with me. And you all know from all this twice journey through this, I understood you all are surgeon very.
The introduction, I'll keep it really brief. It's one of the iodinated contrast media, one among the 8, and it is very vastly used in India. And the counterpart is iopramide. This retrospective narrative analysis of pooled descriptive data of pharmacovigilance activity. In this study, we are examining the incidence of adverse reactions in patients receiving iohexol in our hospital, and we are trying to explore potential contributing factors which was in contradiction to the existent literature. And it also discusses the observed reduction in ADRs following a switch to a new another molecule, that is iopramide. And the method is
it has been divided. So the color image and the corresponding annotated images has been subdivided into different cells. So to handle the high volume of data, we can't process the data directly because it is a 3x cross 4x resolution. So I'm splitting the cells into images into cells. So the entire volume of 100 images, if you take single image from the 100, so it will have 135 sub-images. So each cell has a dimension of 256 cross 256. So the total count of training data from 80, it has become to 8,100 images. So using that as input, I am training the model and I am trying to achieve the inference.
Conclusion, there was low awareness, and women from low socioeconomic backgrounds were largely unaware about major cancers such as cervical and breast cancer. And though women who were educated, who were aware about cervical cancer, they did not go for screening because there were a few reasons. They didn't know where to go. They didn't know what will be done in screening. So they were reluctant to approach for the screening as well. So this is the scope of work. There multiple studies can be done. And because in India, breast cancer is on rise, there is definitely in future, if not taken appropriate steps, ovarian cancer will be the next cancer because it's very closely related to each other.
Thank you very much for your support.